Howdy, my name is Rachel Crandall, and my group and I will be discussing two different diseases dealing with the integumentary system after giving a brief overview of the system. So what is the integumentary system? The integumentary system is simply a set of organs that form the outermost layer of the body, keeping a barrier between the internal environment and the external environment. The first disease we'll be talking about today is shingles. Shingles is the reactivation of the chickenpox virus. Anyone who has had the chickenpox virus has potential to develop shingles. The varicella zoster virus is produced in the body and can lie dormant for years. This virus will travel across nerve fibers to the skin, thus creating the painful rash or blisters that are seen. Shingles affect 1 of every 3 people in the United States. Now for the different types of this disease. The shingles virus doesn't necessarily have different types, but it has different stages. The first stage entails tingling pain or numbness in the area the virus is about to arise. This pain can occur even from the slightest touch. The second stage, as pictured in the top right corner, occurs about 1 to 5 days after the numbness starts. A red rash will arise along with a headache or an upset stomach. The third stage is the stage of blistering. These can break open and leak fluid that contain infectious amounts of the virus. In the final stage, all blisters will begin in the process of crusting over by drying up and closing all open blisters. This happens about 7 to 10 days after the blisters first appear. After the skin is crusted over, the healing process begins, and all scabs should be gone in a couple of weeks. Next, I will talk about some of the common symptoms and treatments for shingles. As discussed on the last slide, each stage of the virus will come with different symptoms. The initial symptoms can differ from person to person. Intense sensitivity can cause pain from just simply wearing clothes or general numbness. When the rash appears, it is common for individuals to experience headaches, fevers, and upset stomachs. The blisters are known as the most painful part of this disease. Once they are open and leaked the contagious fluid, anyone who has not had the chickenpox before or has not had the vaccine is susceptible to being infected. Now for treatments. Shingles is usually treated with an antiviral medication to stop the spread. Numbing cream can also be found to be resourceful because of the severe pain. Once the rash begins to develop, it is critical to see a doctor within 3 days. Without proper medical attention, there can be long-term side effects such as pain or itching.
Shingles is caused by the varicella zoster virus, which is in the herpes zoster class, which causes the STD herpes or just the sores that appear on mouths that are a different form of herpes. And this is contracted when people get smallpox at a young age and it becomes inactive in their system. And then later in life, when their immune system begins to weaken with age and just the body becomes more susceptible to diseases and viruses, the virus tends to reactivate and causes shingles. So we're not entirely sure why it reactivates. The guess is that it's with old age and the weakened immune system. And diagnosis is pretty easy. The clinical diagnosis mostly has to do with if there is a visual rash or lesion on the skin, which can be confused with other types of rashes. So when a practitioner is not sure if it is actually shingles or not, they will run a PCR, which is a polymerase chain reaction. And this is the cheapest and most rapid and sensitive way to test and make sure it actually is herpes, the herpes zoster virus of varicella. A little bit about the histology of it. It shows abnormal cells. And in the top left-hand corner of this slide, there's different types of temporal arteries. that are infected with the virus. It shows the normal ones on the bottom, and then on the top it shows infected ones. And you can just see there's a little bit of a difference in how the stain reacts. So there's not a whole lot to indicate that it's there in histology.
Howdy, my name is Jacob Kramers, and the second disease we'll be covering today is the psoriasis. What is psoriasis? Psoriasis is an autoimmune disease which attacks healthy skin cells and causes red, itchy, and scaly patches of skin along the joints of limbs, the trunk of the body, and the head. Psoriasis is often categorized as mild, moderate, or severe, depending on the amount of skin affected by the disease. There are 7 types of psoriasis. Plaque psoriasis is the most common form of psoriasis and causes stereotypical red rashes with white scales. Guttate psoriasis is a rare form of psoriasis that causes small red spots on the skin. This type usually appears in children and may go away naturally. Pustular psoriasis is an uncommon type which mostly affects adults. Typically, this type causes pus-filled bumps surrounded by red skin to form on the hands and feet. Inverse psoriasis causes red, smooth, and shiny rashes to form in areas which experience a large amount of sweating and movement, such as the armpits and groin. Nail psoriasis is the second most common and results in deformed nails, such as pitting, increased sensitivity, pain, and the separation of the nails from the beds. Psoriatic arthritis may develop in those affected by psoriasis and can cause painful movements of the joints, swelling of the fingers and toes, and discolored joints. Erythrodermic psoriasis is the rarest and most severe form of psoriasis, causing burn-like marks across the entire body and are typically extremely painful and itchy. What symptoms a patient experiences depends on the type of psoriasis they have. Red, itchy patches of skin covered in white scales and extremely dry skin, which may bleed, is common of plaque psoriasis. Small red spots are caused by guttate psoriasis. Deformed nails are due to nail psoriasis, and psoriatic arthritis causes stiff or painful joints. Pustular psoriasis results in pus-filled bumps, and smooth red rashes are the result of inverse psoriasis. Although psoriasis has no cure, there are several treatments to reduce the severity of the symptoms. Topical treatments are used for mild psoriasis and it helps reduce the swelling and skin growths. Light therapy is exposure of skin to UV light, which can reduce inflammation and slow skin growth. Oral or intravenous drugs are used for severe psoriasis. These drugs typically target and suppress the immune system.
All right, thank you, Jake. My name is Wesley Garza, and I'm going to be walking y'all through some of the causes and diagnosis of psoriasis, as well as go through some histology slides related to the disease. All right, so the main cause of psoriasis is an immune malfunction, which causes leukocytes to enter the skin, and that causes excessive growth of the epidermis, as well as hyperkeratosis. This immune response also causes dilated blood vessels within the skin, which creates redness. So you can see here in this photo that the skin is very flaky and red, again caused by that hyperkeratosis and the dilated blood vessels. So the causes of many autoimmune diseases, just like psoriasis, are unknown. However, genetics and environment are thought to play an important role. Many genes have been identified that play a role in psoriasis, but there's no genetic test to determine susceptibility yet. Some of the environmental factors that play a role can include infections, drinking alcohol and smoking tobacco, and certain medications. So, how is psoriasis diagnosed? There's no specific test for it, so it can only be diagnosed by a visual examination of the skin. However, biopsies may still be gathered while the physician is making their differential diagnosis in order to rule out other diseases of the skin. So let's go over some histology slides. In figure 1 and 2 here, you can see that there's increased thickness of the epidermal pegs in the psoriasis patients. And that's where the epithelium is projecting down into the dermis, and it's doing it in very thick layers there. So this is called psoriasiform hyperplasia, meaning an increased cell reproduction rate due to psoriasis. Both of these figures also show hyperkeratosis. You can see this in the very top layer of the skin there, the top layer of the epidermis, where the skin's very hard, flaky, and dry due to the increased keratinization. All right, and in figure 3 here, you can again see that the upper layer of the skin is very thick. However, in this photo, you can see the neutrophils that have invaded the skin. They're much more evident here. So, as the diagram states there, this can occur acutely with infections, but psoriasis leads to chronic leukocyte activity in the skin. So that's another way that you can recognize psoriasis in a histology slide. And then in figure 4 here, you can see the dilated blood vessels within the dermal papillae. And this again contributes to the redness that's very characteristic of psoriasis. All right, and now we're going to go over some test questions beginning with the shingles.
Shingles question number 1 asks us, which of the following are examples of shingles? A, B, C, A and B only, or E, all of the above. So A appears to be rash with blisters, B appears to be the beginning of a rash, and C shows us the histological view of what shingles would appear to be. And it seems to be that E is the answer. Shingles question number 2. What virus causes shingles? A, coronavirus, B, varicella zoster virus, C, human immunodeficiency virus, or D, human papillomavirus, or E, all of the above. The answer would be B. Shingles question number 3. Which stage of shingles matches its description? A, stage 1, painful blisters develop. B, stage 2, a red rash appears with other symptoms in a certain area of the body. C, stage 3, blisters crest over. And D, stage 4, tingling, pain, or numbness. E is all the above. The correct answer is B. Step 2, a rash appears with other symptoms in a certain area of the body.
All right, let's go over some questions for psoriasis. So you can see your question number 1. Which of the following characteristics match the image of psoriatic skin? So you have A, hyperkeratosis of the epidermis, see where that's pointing to. B, psoriasiform hyperplasia. And C, dilated blood vessels of the dermal papillae. So the answer here is D. There is hyperkeratosis of the epidermis, right where A is pointing to. You see those increased layers and flakiness. And B is also correct. You can see in the epidermal pegs there, where they're projecting very deep down into the dermis, deeper than usual. So that one's correct. And C does not show a dilated blood vessel in the dermal papillae. In fact, it's not in the dermal papillae at all. All right, let's go to question number 2. So which of the following images are characteristic of psoriasis? You have A, B, and C here. So if you look at A, you see some of that redness and flakiness on the elbow. B, might be looking at some psoriasiform hyperplasia. You see the hyperkeratosis, the thickened, flaky upper layers of the skin. And C, there's not too much to look at here, just looks like regular thin skin. You see there's not too much increased epidermal thickness. The epidermal pegs look normal, so do the dermal papillae. So the answer again is going to be D. It's A and B only. And then question number 3, which symptoms can be caused by psoriasis? So we have A, red and scaly patches of skin, B, deformed nails, and C, painful and stiff joints. So the answer is E, all of the above. The red and scaly patches of skin is caused by plaque psoriasis. The deformed nails are caused by nail psoriasis, and painful, stiff joints are caused by psoriatic arthritis. All right, so here's our work cited, and thank you for watching.